Hey, Dr. Birchler here. I got into chiropractic as a teenager. I didn't know what a chiropractor was, and I hurt my back playing basketball and had my first chiropractic experience, and now I am a chiropractor. So it kind of changed my life. But here we are in the middle of August currently, and high school sports are getting going again. College sports are starting up. You got football, you got soccer, other things as well. And I always think back to my personal story, and I think about the other kids that are out there right now. I think about the kids in my practice, and I can reflect on some experience as a coach as well some years back, seeing high school kids tear their ACL. I've had few of those of students that I've seen that I've known, and man, what a frustrating and life-changing thing that is to be playing and then have a season-ending injury, maybe a career-ending injury. And if you're an athlete who may be good enough to be going on to the college level, that could change your chances of doing that. And if you're an athlete who's good enough to go to the college level and get a scholarship, man, it can really be a life changer if you have injuries which inhibit your ability to perform. And so I wanted to share with you just a couple things to look for in your kids. I've always been intrigued by the idea that if you took 100 kids and lined them up in front of me, would we be able to see the kids that are prone to blowing out their ACL, injuring their shoulder, their labrum, or is it just random? And I would tell you that it's not random. There are signs in the body of imbalance, unevenness, predisposition to injury. And then when you couple that, excuse me, with understanding the high risk age, you can really say, hey, my kid needs to be taken care of, or this is a time frame to have them checked if they're going to be an athlete, and you want them to perform well and avoid injury. So there's some pictures here on this screen. In this case, looking at feet, one of the factors that would predispose to knee injury or other injuries would be arches that are uneven, and or leg length that's uneven. And we can assess that through doing a weight-bearing scan of the feet and also taking x-rays looking for pelvic tilt and inferring the leg length. If you're a throwing athlete in particular, unevenness of the shoulders, most commonly the throwing arm in a throwing athlete will get low compared to the other arm. And then there's a correlation between that and labrum injuries and rotator cuff tears. And of course, these are a big deal for baseball pitchers and that kind of thing. So simple posture assessment, you're often able to tell whether there's an imbalance in the throwing arm. And the proportion of the unevenness correlates with the risk of injury. This little guy down here, this is showing the difference between somebody with a relatively normally aligned spine versus a head that protrudes forward from the spine. And the head protruding forward is a negative thing. Higher incidence of neck injury, back injury, shoulder injury, just about any type of injury in that case. That's easily assessed posturally and with x-ray. Then there's a couple pictures here showing the knee alignment and whether the toes are rotated in and out. And sometimes you may see that one foot or toe points relatively forward, but the other one angles out to the side. So there's a misalignment either in the pelvis or sometimes in the knee, sometimes a foot or arch issue. And there's a picture here showing the flattened arches or the bowed Achilles tendons. And those things would correlate to ankle injuries, knee injuries, and whatnot. These are all things that are relatively visual that you can see on your own kids. So if you see these things and your kid's an athlete, understand, hey, if you take care of their body, they're a high-performance machine. If you take care of their body, they're going to perform better, but they're also going to have decreased risk of injury. And seeing as it's that time of year right now, for an athlete in season, in particular something like football where you have a lot of contact, you have a lot of, oftentimes they're weightlifting, they're tackling, they have a lot of stress going into the joints. I recommend kids get checked every week of the athletic season, just period. If you're a serious athlete, get yourself checked so you can perform your best and decrease risk of injury during the season. The ages that are at most risk, in particular of things like ACL tears, these would be serious season-ending injuries. are going to be when the kids are growing really fast, and then they're skinny as toothpicks. So peak growth for females occurs at about age 12, and for males it's about age 14. So they're basically going through puberty, and they might grow a lot in height, but they're still really skinny. They have like the Bambi legs. They're really thin. Their muscles haven't really caught up to their height, and so their joints are relatively unstable as they've gone through a rapid height advance without much muscle mass or time for the body to get used to that and stabilize that. So certainly if you're a multi-sport athlete or year-round athlete, your child's in that situation and they're at that age bracket, this is just a vital, a crucial time for them to have their spine checked, have their body checked to make sure that they have a good combination of mobility, alignment, stability for them to perform and decrease risk of injury. Hope this helps. Thanks.